Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Welcome back to the deep dive. Imagine this, a disease that hit 249 million people worldwide in just 2022
Yeah, it's hard to even picture that scale.
and led to over 600,000 deaths. We're talking about malaria. It's an ancient problem, but here's the twist. A huge part of those infections are actually asymptomatic.
Meaning people feel completely fine. No fever, no chills.
Exactly. They're carrying the parasite, but show no symptoms at all. And that unknowingly fuels transmission. It's a really sort of insidious challenge for trying to eliminate malaria.
It really is. I mean, these asymptomatic carriers, they're like a massive blind spot. If you don't know someone's infected, well, you can't treat them.
Right.
And they just keep acting as a reservoir for the parasite, passing it to mosquitoes, which then, bite and infect other people. It's like trying to put out a fire when half the embers are hidden.
That is a perfect analogy. And that exact problem is why today we're diving into something potentially groundbreaking. It's a simple, well, seemingly simple, paper-based diagnostic device.
Yeah, looks simple on the outside.
But it could totally change how we find and maybe finally eliminate malaria, especially in those really hard-to-reach places with few medical resources. Our information today is mainly from a recent health news piece, which leans heavily on a scientific paper from the journal Analytical Chemistry.
A solid foundation, then.
Definitely. So, okay, let's unpack this a bit. Why is finding this asymptomatic malaria so incredibly important? I mean, if someone's really sick, it's usually obvious, right?
Right. When someone's acutely ill, their parasite load, the amount of parasite in their blood, it's typically quite high. Diagnosis is, relatively speaking, more straightforward then.
Okay.
But for these folks without symptoms, the density of the parasite in their blood is often really, really low. And that low density makes them incredibly hard to diagnose using our standard methods.
So they slip through the cracks.
Exactly. They remain undetected, they don't get treated, and crucially, they keep the transmission cycle going.
Which brings us to the tests themselves. What are the limitations we're currently facing with finding these hidden infections?
Well, historically, the gold standard in many African hospitals is microscopy, looking at blood samples under a microscope.
The classic method.
Classic method. And it works pretty well for symptomatic cases, the ones with lots of parasites. But it really struggles with the low parasite density you see in asymptomatic people.
How much does it struggle?
Well, in one key field study we looked at, microscopy only flagged 24 positive cases out of 266 volunteers tested.
Wow, only 24 out of 266. That's missing a lot.
A significant number, yes. And it's not just microscopy. Rapid diagnostic tests, RDTs you often hear about, they're used everywhere because they're fast and portable.
Right, the little dipstick things.
Those ones. But they also perform poorly when the parasite density is low. In that same study, they only picked up 63 infections.
Better than microscopy, but still 63 out of how many were actually positive?
Well, that's where the most accurate method comes in polymerase chain reaction, or PCR.
PCR. We hear a lot about that these days.
We do. It's a molecular test. Super sensitive because it looks for the parasite's genetic material, even tiny amounts. In that study, PCR found 142 positive cases.
Okay, 142. So microscopy found 24, RDTs found 63, but PCR found 142. That gives us a much clearer picture of the real infection rate.
It does. But here's the big limitation with PCR. It needs extensive sample processing, specialized lab equipment, trained staff.
Not exactly portable.
Not at all. It's really hard to get PCR capability out into the remote areas where malaria often hits hardest. So you have high accuracy, but very low, you could say, deliverability to the field.
Right. So we need the accuracy of PCR, but something you can actually use easily anywhere. That's the gap.
Precisely.
And this is where Professor Abraham Badu-Tawaya and his team at The Ohio State University come in with this, well, ingenious solution, a new paper-based diagnostic. Honestly, when I first read paper-based, I thought, how could that possibly work?
It sounds almost too simple, doesn't it? But it's actually quite sophisticated underneath. It's a great example of clever engineering.
Professor Badu-Tawaya has a great quote about it. He says something like, typically you take the sample to the lab, but now we are taking the lab to the sample.
I'm taking it to Africa, one of the remotest parts of the world, and doing the analysis right there. Yeah, it captures the whole idea perfectly.
It really does.
What's so fascinating here is how this simple material, paper, is used to enable such a complex and precise chemical detection. It's all about bringing that advanced analysis right to the point of care.
So take us through it. How does this seemingly basic paper strip actually work?
Okay, so imagine cheap strips of paper layered together. Certain sections have wax printed on them.
Like little barriers.
Exactly, to create tiny channels and stop the blood from just soaking everywhere. You apply just a single drop of blood onto the device.
Just one drop.
Just one drop. It naturally wicks through the paper and gets separated into 4 small chambers built into the layers. These include positive and negative controls, which is important for reliability. As the blood moves through these paper layers, it triggers specific chemical reactions that are preloaded into the paper.
And the key part, how does it detect the malaria?
The core mechanism uses something called ionic probes. Think of them like tiny molecular fishing hooks, custom made.
Okay, fishing hooks. I like that.
They're designed to latch onto one very specific protein made only by the malaria parasite in this case, something called Plasmodium falciparum histidine-rich protein 2. It's like the parasite's unique fingerprint.
Even if there's only a tiny bit of it.
Even if there's only a tiny bit. These probes basically grab that protein, that antigen, out of the blood and stick it permanently onto the paper. This happens pretty quickly, within about 10 minutes.
Wow, so it's like a tiny lab on paper capturing that specific malaria signature. What happens next?
After that capture step, you do a simple wash with a buffer solution, just a liquid, to rinse away everything else, all the blood components that aren't stuck to the probes.
Cleans it up.
Right. Then you carefully peel the paper layers apart. And this is where the analysis happens. You use a handheld mass spectrometer.
Handheld mass spectrometer. That sounds less simple than paper.
It sounds complex, but these are becoming more portable. Essentially, it's a device that can accurately weigh molecules. Every molecule has a unique mass, a unique molecular weight, like a barcode.
Oh.
The mass spectrometer measures the mass of whatever is stuck on that paper strip. If it detects the exact molecular weight, the barcode of that malaria protein, you have a positive result. If not, it's negative.
And how long did that analysis take?
The results are usually ready in about 30 minutes total, from applying the blood drop to getting the answer.
30 minutes. That's pretty fast for something so sensitive.
It is. And, this technology has evolved quite a bit since it was first conceived around 2016. Professor Badu Tawaya's lab developed a way to store the antibodies and those ionic probes right in the paper using a sort of 3-dimensional automated process. Makes them really stable.
So they're ready to go off the shelf.
Exactly. And they've also added another molecule, kind of a booster molecule, to amplify the signal, make it easier for the mass spectrometer to read, especially at low concentrations.
Clever refinements.
Very. Now, actually making the devices is still a manual process at the moment, but the chemistry packed inside is much more advanced. And here's a really crucial part. Once you've done that wash step, the used paper strip with the captured protein is stable. Completely stable, meaning you can store it indefinitely without any refrigeration, put it in a regular envelope, mail it somewhere else, maybe to a central lab with more resources, for confirmation or further analysis later. No cold chain needed.
That's huge. Eliminating the need for refrigeration, that's a massive hurdle overcome for remote settings.
A game changer for deliverability.
Okay, so this is where it gets really interesting. How did this paper device actually perform in the real world? You mentioned a field study.
Yes, the proof is really in the pudding, or in this case, the field test. The team did a 5-week study in Ghana back in 2022. They had 266 volunteers, all asymptomatic.
People who felt fine but might be carrying the parasite.
Precisely. And they tested everyone using 4 methods. The standard microscopy, the rapid diagnostic tests, the highly accurate PCR, and their new paper-based device. Then they compared the results.
The comparison must have been stark.
It was pretty dramatic. Remember those numbers? Microscopy found just 24 positives. The RDTs found 63.
Right.
The paper-based devices, they identified 184 positive cases.
Whoa. 184 compared to 24 and 63. That's incredible.
It translates to about 96.5% sensitivity for the paper device and around 90% overall accuracy, which is very comparable to the gold standard PCR result of 142 positives in that same group. There's some discrepancies still being worked out, but it's in the same league.
So essentially catching almost as many infections as the complex lab test, but with a simple paper strip and a handheld device.
That's the takeaway. Professor Badu Tawaya pointed out exactly what we discussed. Microscopy often failed simply because the parasite levels were too low in these asymptomatic people, but the paper device excelled right where the others struggled.
You can immediately see how vital that is for actually finding those hidden carriers and stopping the spread. Now, I remember reading there was a slight issue, something about false positives initially.
Yes, that's an important point. Initially, the paper device slagged 47 results as positive that were later confirmed negative by both PCR and microscopy.
Okay, so what caused that?
The team investigated and found it was likely due to differences in blood viscosity, how thick or thin the blood was from person to person. This could sometimes affect how the blood flowed during that washing step.
Physical issue, not a chemical one.
Exactly. And the good news is they quickly identified it and modified the device design slightly to account for that variation in viscosity. It shows they're actively refining it based on real-world use.
That adaptability is definitely key. So, pulling back, what does all this mean for the bigger fight against malaria?
Well, the potential impact is enormous. This kind of diagnostic advance could genuinely accelerate global efforts to eliminate malaria. If you can accurately find and then treat these asymptomatic carriers, you can finally break that cycle of transmission that's been so hard to interrupt.
And the cost and deliverability, those seem like major factors too.
Absolutely. If we connect this to the bigger picture, it's not just a new test. It could be a whole new way of doing diagnostics for many diseases. Cost-wise, the paper device itself is estimated around $2.50 per test. Now, that excludes the cost of the handheld mass spectrometer, which is still significant, but the test itself is much cheaper than PCR, which runs maybe $7 to $8 per reaction, plus called a lab overhead.
So potentially more affordable at scale for the test itself.
Potentially, yes. But the real game changer, as we said, is that high deliverability.
Yeah.
No complex sample prep like microscopy, no fussy transport of liquid blood like for PCR. These paper strips are stable when dry, easy to transport, analysis is relatively straightforward. It's designed for tough environments.
That high deliverability is critical, especially thinking about widespread surveillance. Professor Badutawaya mentioned something about vaccines too.
Yes, he made a really important strategic point. As malaria vaccine uptake hopefully increases, especially in places like sub-Saharan Africa, the population's natural immunity might actually decrease over time.
Because fewer people are getting constantly exposed.
Exactly, which ironically makes widespread sensitive surveillance even more critical to catch any remaining infections or outbreaks quickly. He sees this paper technology going hand in hand with vaccination. You need both.
That makes sense. And this isn't just limited to malaria, is it? The potential seems much broader.
Oh, definitely. That's one of the most exciting aspects. Professor Badutawaya is already working with doctors to adapt these same devices for other things.
Like what?
Detecting risks for conditions like colorectal cancer or acute pancreatitis. The underlying technology, the paper platform, the ionic probes, the mass spec readout, it's adaptable. You just need to change the fishing hook, the specific antibody on the device, to target a different protein or biomarker associated with another disease.
Wow.
He put it really well. I have the hammer now, and I could hit different nails.
That's a great line. So the same core invention could tackle multiple health challenges just by swapping out one component.
That's the vision. It's potentially a platform for democratizing advanced diagnostics, taking complex lab tests and making them accessible almost anywhere.
It really is remarkable. We've seen how this deceptively simple paper device could have such a profound impact on global health, really transforming the malaria fight by finding those hidden infections with an affordable, deliverable solution, something that used to need a high-tech lab.
Yeah, it really makes you pause and think about how innovation can come from unexpected places, even simple materials like paper.
It does. And maybe this raises a final thought for you, our listeners, to consider. Beyond the clever science, what does a truly deliverable health solution actually mean for equity worldwide?
It's one thing to invent it, another to implement it effectively.
Right. How do we make sure breakthroughs like this don't just stay in labs or reports, but actually reach the communities that need them most? How do they get integrated successfully to empower people who've been underserved for so long?
That's the next big challenge, isn't it? Ensuring access and impact.
It really is. It's a lot to think about how humble materials and smart science can come together to tackle these huge global health problems. Join us next time on The Deep Dive for another exploration.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.